Years ago for the Lancet, funded by a consortium of funders, including John's institution, and we were really looking to try and get some quantitative estimates of these kind of collateral benefits to health of low carbon strategies. Because up to then, although people had talked in general terms, particularly around air pollution co-benefits, no one had tried to look across a range of different sectors and see what the totality of the benefits might be. Well, to do that on a global scale, because it's very difficult, very taxing, and we had a fairly short time and limited resources. So what we did was to use a number of case studies to exemplify in different kind of situations, both high and low income countries, what might be achieved. And we focused on 4 sectors: household, energy, urban land transport, food and agriculture, and electricity generation. We chose those 4 sectors because they're responsible for large amounts of greenhouse gas emissions. And at the same time, they're quite closely interrelated with health, using a range of different pathways that I will talk about. So what we did was to try and look at the health effects of strategies to undertake radical reductions, say 50% of reductions in developed countries of greenhouse gas emissions. Let me give you some examples. The first one of these relates to the situation in many low-income countries where you have large numbers of people cooking on traditional biomass stoves or open fires, and the latest WHO estimate suggests perhaps around 2 million deaths worldwide from indoor air pollution, particularly in women and children. And it's recently become apparent that there are links here with climate change, because one of the side effects of this incomplete combustion is the production of large amounts of black carbon. Now, black carbon is a greenhouse pollutant, and also when it's deposited on glaciers in the Himalayas, for example, it accelerates the melting of glaciers. You also get a number of other greenhouse pollutants produced by this incomplete combustion process. And with modern technology, illustrated here on the right as a gasifier stove, you can actually get dramatic reductions in black carbon, 15 times less, and substantial reductions in some of the other greenhouse gases. So the technologies are available, they're not widely taken up, but they are becoming increasingly available. So we modeled the effects of a stove program in a country like India, introducing 150 million stoves over 10 years. Sounds a lot of stoves. Well, it is a lot of stoves. The Chinese government implemented a similar program in the 1980s, 100 million stoves, so it is feasible to do with political will. And what we calculated was that about 2 million premature deaths would be averted by such a program, mainly in women and children from acute respiratory infections and chronic obstructive airways disease. And in addition to that, you get up to 1 billion tons of CO2 equivalent reduction over the decade. And that would cost only about $50 per household every 5 years to implement a stove, which actually lower tech than the one that I showed you in the previous slide. We also showed that in high-income countries you could also get benefits in the housing sector, maybe not as great, but because of the inefficient housing in many countries, including my own, you can actually get substantial benefits in terms of heating and also, to a lesser extent, indoor air pollution. But moving on to the transport sector, this slide just shows you the projected forward emissions from transport between 1970 and 2050. And as you can see, there's going to be a dramatic increase in transport-related emissions, quite unsustainable, with road really contributing the largest amounts there. So we actually modeled two scenarios in London and Delhi, looking at the effects of a low-carbon transport strategy, that's to say using less polluting vehicles, but also more walking and cycling. We looked at the impact of that on air pollution, traffic injuries, and also beneficial effects from less sedentary lifestyles, beneficial effects of more walking and cycling. And what we showed, to just give you the headline figures, in a city like Delhi, you get substantial improvements in ischemic heart disease, stroke, up to 25% reduction, by a scenario that assumes substantial but not infeasible increases in active transport. And you'd actually get a reduction in road traffic crashes, because current trajectories are for a dramatic increase in car use, and that will increase the burden of deaths due to road traffic crashes. So in a city like Delhi, you get some substantial, really major healthcare benefits, and in a city like London, slightly smaller in magnitude, but nevertheless overall beneficial. When we look at the healthcare savings from a strategy such as this in England and Wales, it's some work we've just been doing very recently, not yet published. What we find, this is billions of pounds, so if you're thinking in dollars, roughly 50% more, perhaps $20 billion of cumulative healthcare savings over a 20-year period or so from preventing all these diseases which are related to sedentary lifestyle. So this was based on systematic reviews of the association between sedentary lifestyle and these various diseases. And what you can see is a very major and accelerating, obviously, cumulative benefit to the health system, even when you discount those benefits by 3.5%, which is what we've done here. So really quite substantial benefits. Moving on to electricity generation. This is work done by my colleague Anil Markanja and his colleagues in Bilbao in Spain. And they modeled the effect of a low carbon electricity generation strategy for the EU, India and China, using a number of technologies here. And what they did was to look at the number of deaths that could be prevented from particulate air pollution by putting in place low carbon electricity generation. And what they suggested was that by 2030 you could be avoiding over 90,000 deaths per annum in India, over 50,000 in China, and somewhat less, but still useful, 5,000 in the EU. Now I should emphasize this is actually quite conservative because they didn't look at the total removal of fossil fuels, they looked at a very much an incremental strategy. If you look at the benefits that are achieved through this, if you value these in economic terms, in India, for example, the health benefits actually offset the costs of moving to a low carbon energy wholly, and in the case of China and the EU, partially. What we're seeing now is the advent of new technologies, and this is one proposal which is on currently sort of on the table, to develop concentrated solar thermal power across North Africa, Southern Europe, to link it into a very high efficiency, high voltage direct current grid, which would power North Africa and Europe using renewable sources. And obviously that would have much greater healthcare benefits because that would emit virtually no particulates. And it's worth noting that within 6 hours the world's deserts receive more energy than the world uses in a year. So there's plenty of energy out there, clean energy. And then finally, agriculture and food. This just shows you again these unsustainable trends. These are the global trends, but they're going up in all regions. We then looked at the impact of reducing saturated fat due to animal products in countries in the UK, but also in Brazil. And we did that because 80% of the total emissions in the sector come from livestock production. About 10 to 12% of greenhouse gas emissions worldwide are from food and agriculture, and up to another 18%, 17-18% if you include land use change and deforestation. So you can't ignore it. And what we found using with the UK and Sao Paulo in Brazil was that if you could reduce livestock production, animal source saturated fats by about 30%, you could reduce the heart disease, ischemic heart disease, by about 15% in both of those settings. So substantial benefits. How you do that, we can debate whether it should be a saturated fat tax or whatever. It's a matter of debate. And then finally, just to say that the health system itself is quite a major emitter of greenhouse gases, perhaps 8 to 10% in the UK. Our National Health Service has a carbon footprint of about 18.6 megatons. Interestingly enough, a lot of that, about 60%, is related to the upstream, to the goods and the services they procure. So, for example, pharmaceuticals are very energy intensive. And this surprised me because I assumed that the energy costs were all coming from running hospital buildings, but actually a lot of it is in the actual procurement policy. And so now they're developing sustainable procurement policies to try and work with the pharma and other equipment industries to drive down their carbon emissions. The so-called Carbon Disclosure Project, sustainable food guides for hospitals, energy efficiency guides for medical devices, and promoting active transport for health service staff. So in conclusion, I think we can say the low carbon economy is generally likely to be good for health. Not invariably, I mean there are some things that are bad for health, like some biofuels for example. So that's why we do need to have impact assessment. The co-benefits can offset the costs, and they're additional, of course, to the benefits from reducing climate change. And I would go so far as to say, unless we address some of these root causes, we will not fundamentally be able to tackle the NCD epidemic. So the two things are inextricably linked. Our dependence on cheap fossil fuels, well, getting more expensive, but certainly the profligate use of fossil fuels to power our economies, and the NCD epidemic. And I would just conclude by saying that I think health professionals, of course, have a very important role in promoting the low-carbon society by demonstrating the benefits that can occur for a whole range of different health outcomes that we're struggling to treat through hospitals and primary care. Thank you very much.